be good. Be still, my Welcome to Speak Sex. I'm your host, Eurydice. I'm your sex whisperer here in the podcast universe. And today I have a guest from LA, Victor Torrente. He works with BostonScientific, and he's going to tell us all about penile enhancements and hacks for men who want to improve if you're the listener, men who want to improve their sexual abilities, functionalities, and especially confidences. So this is I feel that this is a problem that's more and more widespread, but still kind of kept under discussed. Some people say it's because of our lifestyle. We're so busy. We don't rest. We don't sleep enough. You know, we're always like go, go, go. And then like our sex life or our dating life has become part of our performance life. So we find it difficult to switch from one modality to another. Right now in lockdown, we definitely have seen that we can all switch to the other modality, which is like more feminine and slow and restful and loving, which is really the ideal modality for sex. But in our non-quarantine life, you know, when we like go, go, go so fast to be productive, in this 21st century lifestyle that we live, it's hard for people, especially for men, to switch out of that. And I think that that's one of the reasons, the most common reason nowadays, that more guys have a harder time with ED, which is erectile dysfunction, with staying hard, with staying hard long enough to please their partner, and long enough to please their standards, right? So we've also become perfectionists, and men have also learned recently, like literally since the 60s or 70s, that they are better lovers if they please their female partners and make them come. So that I think that is like a factor, right, in wanting to sustain it. Before, it was just an issue of like, you know, the guy comes and the sex is over, I think.
Yes, of course.
Right. So, but anyway, you know, I think also some of it is physical. I don't know, you know, again, diet, lifestyle, who knows? But, you know, definitely with the passage of time and age, you know, men find that their testosterone levels get lower, their sexual stamina seems to not be what it used to be. So the irony of all of this is that when you're young and you don't know what you're doing, you know, the machinery like performs at its best. And then when you reach an age when you finally figure out who you are, what your, you know, preferences are, what your sex tastes are, you know, how you like your partner to be, then the machinery kind of like, you know, leaves the room when you want it to, you know, show up for you. Early on, people used to say that Viagra might not be healthy or, you know, have side effects, but actually studies have shown recently that it's good for your cardiovascular health and it has other benefits, right? So
right. Mm-hmm. So when Viagra came out in the late 90s, Yuri, what it did is it kind of opened the door for people to talk more about erectile dysfunction, especially men. You know, when these pills first came out, before that, the treatments were a little bit more invasive. You had to either do an injection into your penis, maybe put a little vacuum over it, like Austin Powers, if you guys remember the Austin Powers movies, put a vacuum over it, or you can do a penile implant. But once the pill came out, anybody that had just a little bit of erectile dysfunction or a lot of it, they weren't so hesitant to try a treatment because all they had to do was take a pill.
So yeah, but and the other thing with Viagra and more recently Cialis is that, you know, the gay community, who are always like at the forefront of all this like sexual liberation, work, to embrace it, even though they didn't have dysfunction, as like as solely a sexual enhancement. So, people would have like Viagra or Viagra and ecstasy, and enhance the sexual pleasure. So then what that did, because because it was done in such frequency, in great numbers in the gay community, is that it kind of slightly separated in our consciousness from dysfunction, right? So it didn't really mean necessarily that you couldn't. It could simply mean that you wanted it better, that you wanted to like heighten the experience. So that was also helpful psychologically for guys, because unfortunately, like for reasons that are primitive and procreative, 100% procreative and primitive, like a man's manhood is so connected to like his priapic, his phallic achievements, let's say, whether it's like the size of the penis, which is ridiculous, but has survived through like hundreds of years, or like the length of the hard-on or the virility, whatever you call it, these ideas and assumptions that are really primitive and should have no place in our, digital lifestyle, in our online existence these days, have survived, So men think this is like part of my value as a man. Oh no, I've been emasculated. So first of all, we should do away with all that thinking, because it's so outdated. It doesn't really fit this day and age, right? When, babies can come out of sperm banks and petri dishes and whatever. So, but yeah, Viagra definitely did a lot to separate the idea of dysfunction from the idea of just having better sex. So, and exactly, I think that,
and as you mentioned, as guys get older, their erections aren't as rigid as they used to be. So many people who have maybe a semblance of erectile dysfunction, many guys will take Viagra just to have a hard enhanced erection in the morning, at night, and a couple hours before they meet with their wife or girlfriend or partner, because they feel, hey, I don't really have quote unquote erectile dysfunction, but I want to be able to get it up harder and faster than I used to when I was 18 and 25, like you mentioned.
Yeah. And what's the word on the street? Like, do you get addicted a little? Because I have heard that people like that once you go there, you don't want to go back, that like it feels so much better that then,
right. It's more, they say it's more habit forming than addictive. You
habit
still get your
forming,
erection if I guess if a guy runs out of his prescription, if he doesn't have it, hey, he can still have sex, but he'll be thinking in the back of his mind, maybe, hey, this could have lasted longer, or my erection could have been not necessarily so much harder, but what they call the refractory period, which means the time between erections, which means, hey, I can have sex at night at 10 o'clock, and then I can have sex again at 11 o'clock instead of, waiting till the morning because I can't get that rigid erection right after having sex the first time.
Yeah, like you do in your 20s when it's
right, exactly. And funny thing you mentioned earlier about guys, being so connected to an erection. In my line of work where I sell the penile implants, these gentlemen have already done the erections. Some of these patients, as late as the early 90s, but most of their patients are in their 60s and 70s that get these implants. Sometimes even if they're diabetic, maybe 40s. But what some of these guys have is they just want to be able to get an erection because they haven't had one in 4 or 5 years. Viagra stopped working and the injections didn't work. And they just want to be able to get an erection and feel like a man. Some of these men don't even have a wife or a lover. They just want to either masturbate or just feel like they have an erection because, that's somehow primordially is tied with men, that if they don't have an erection, they don't feel complete as a man. Much akin to like a woman who maybe would get a mastectomy and she wants to have her breast back and her husband's like, no, darling, I love you the way you are. She's like, I don't care. I feel more like a woman when I get my breast back after, breast cancer or something like that.
Yeah.
So in a way it ties like that. Men don't feel complete unless they have, an erection. Most men, there's always the exceptions to the rules.
And that makes sense. I mean, that makes sense from the point of view of how long we've been that way, So like if you think that, we have been whatever, postmodern,
right.
for like 50 years, let's say, with all of these changes that science has brought on, including like the pill, where women
Right.
don't get pregnant, like things that we now take for granted that are pretty recent. It all kind of shifted around the 60s. Which is really, people were alive. A lot of people who are alive now were alive then. So it's like in the span of a lifetime that all of this changed and our sex lives changed. And so here we are like dating online, but nevertheless, we have like thousands of years, of like our DNA being programmed to function a certain way. And yes, like the virile guy, like gets the respect or gets the girls, and that's how it was. That's how it was in the jungle, right?
Right.
So I mean, even like with this, you read like about the wet market in Wuhan, and who knows if it came from live animals or if it came from a lab-made hybrid virus or both or whatever. But the point is, this whole like fetish for eating live wildlife, for eating it freshly killed. I mean, wildlife in China is based 100% on like these assumptions for virility.
Right.
You drink the blood of a snake, you're a stronger man.
Right. Shark fin soup, tiger claws, all that stuff.
All
Manta
that
ray,
stuff.
gills,
Yeah, it's the same thing. It's just like a more like shamanic, whatever, old version of the same
Yohimbi.
kind of. Yeah, exactly. Anyway, so you mentioned the injections and the sleeves. So let's kind of describe them in detail first. So the injection is like a little tiny. It's a tiny needle, right? Just to explain, It's a little bit like giving yourself a B12 or a diabetic shot or something. It's not like a big, scary needle.
Yeah. Right.
And that the shot goes straight into the penis, right?
Right.
And
right. So like anything, the
how
first
long
option
does that last, or how much does that cost?
Right. The usually, like in most cases, the bone pain, high blood pressure, etc. Your first recourse is the pill. Once you take the pill, every guy will always say, "I'll take the pill," unless they have heart issues where they can't take the pill. If they're taking nitrates. But most guys will always try Viagra or Cialis or Levitra first. Once that starts to fail, then the other options are one of them. Now, failure for Viagra, let me remind you, or let me tell you, most guys will take Viagra and it works great. A couple years later, it's not working so good because, like most people, they haven't changed their lifestyle. They're still, whatever it might be, eating too much red meat, drinking too much, not exercising enough, eating the wrong foods. And that also affects the blood flow because your arteries start to get calcified down in that area. So once the pill stops working, he ups the dose. Just like anything else with blood pressure or cholesterol, the pill stops working. So what the injection is, they call them, it's either a mixture of 3 or 4 medicines. They can be called either trimix or a quad mix. Trimix is what primarily people go with. What it is, it's an injection that, in layman's terms, brings the medicine right to the source. You don't have to take it and wait for it to get absorbed by your body. It doesn't matter if you ate or drank before it. It's going to go right into your penis, onto the side of it. Now, it's a small little needle, maybe like, a 1/4 inch long. It's really thin. So it's not the kind of needle we all envision like in a movie. What it does is a patient will first go to his doctor, and if they want to try that therapy, the doctor will give them a test dose first because they have to find out the right dose that's going to give the guy an erection. Because you don't want to get an erection for too long, because that's called priapism. If you get an erection for too long, you're going to cause irreparable damage to the tissue in your penis. What happens is that when the blood flows into the penis and it doesn't come out, that blood sits there and then it coagulates. It turns almost into like rockish or stone, almost like a scab, because if the blood can't come back out of the penis, it starts to dry up because there's no blood flow in there. So if you have an erection for 3 or 4 hours, or longer, you might have permanent damage. You have to go to the doctor and get an injection to bring it down. So that's why usually a doctor, when you're going to try the injections, will give you a little dose in his office. You sit around, wait for 30 minutes, and you're like, okay, I got 75%, and then he'll up the dose. So now he knows what your dose is.
And we're talking about the urologist, right?
Yeah. Always if you're going to get an injection or an implant or even vacuum therapy, from that point, you've graduated from an internist or a GP to a urologist, because they know the urologist has all the concoctions
and most
on his
insurances
office.
cover that. I feel most
Yes,
insurance
yes.
plans, yeah,
Most insurance covers the injections, the vacuum therapy,
and the visit.
Medicare. Yeah, the penile implant is covered by Medicare, so
That's
most
so
of the guys
cool.
are Medicare age that they can get that. All they have to do is, if Viagra or something like that fails, boom, you can go right to the implant. Actually, the AUA, which is the American Urologic Association, in their guidelines, they say after the pills fails, you can try any of the modalities,
Available,
the
right.
injection, the vacuum, or the penile implant. 10, 20 years ago, doctors would tell the patients, oh, the penile implant is your very last resort. But now doctors or urologists, they lay it out for most of their patients and say, look, these are your 3 options. Which one do you want to try?
So
Now,
the injection, once you find the right dosage for you, you do it like a few minutes before, right?
Yeah, like maybe 30 minutes to 30 minutes or so to an hour before before you're gonna have sex. The vials have to be refrigerated, so that's something a man has to keep in the back of his mind. He needs to be either in his house or somewhere refrigerated. If he's going to travel with it, that's something he has to think about putting in dry ice in his luggage. So the injections have to be.
And how long does it last?
It lasts usually, enough for intercourse. It's not something that stays in the system for hours. It's something that probably lasts, I would say, about in 1 to 2 hours, so the patient can get a good erection, and eventually it starts to diminish.
Right. Okay. And I feel that people like that option a lot because it's the least work. Like they don't really have to, they can just go to the doctor, get the vials, keep them in the fridge, and go right back to their lifestyles. Like it's the least amount of effort.
Right. Now, the injections as well, I think the numbers, and I might be misquoting, but after like between 4 and 6 years, they stop working as well. Guys, because what happens with it's also a medication like a Viagra, the potency gets less and less and less. The doctor will always up the dose. There's a little bit of scarring, like because you're always sticking a little needle in your penis.
Yeah, you don't want to do it on the same spot. That's very important.
Right, you got to go back and forth.
Like a little whatever.
Yeah, slight peyronie. So you have a little bit of a
indentation. So you don't want to look like pockmarked.
Right. But but the injections work. It's a medicine. It works.
Yeah,
and some guys,
and it doesn't hurt. I mean,
it doesn't hurt. It sounds more painful than it is.
It's not. Yeah, it does. It really doesn't hurt once you figure out the first 2 or 3 times.
Right.
I feel like it's such a tiny needle, and plus like the desire should overcome that ickiness.
Right. Exactly.
Yeah, but I mean, we hear stories like Weinstein was one of the of the most famous stories that came out, where like now that during the trial, the women spoke of finding the needles in the bathroom and kind of like the scarring that had occurred. And
really? I did not know that. Yeah.
Yeah, and I'm sure that knowing his pathology now, he did not. He was not moderate. I mean, who knows? The man definitely did not have a sense of moderation at all. So
yeah, exactly. Yeah, by and you can tell by his look and weight, he probably did have erectile dysfunction at his age, being so obese. He didn't take care of himself. He probably has not just that, but diabetes, cholesterol problems, heart problems.
He does. Yeah, they talked about all of that, and yet it's like the will, the willpower. So it's important also to remember. I feel for all of us, women and men, that like we should not drive our bodies as if they were our slaves, right? As if they were like beasts, right? We are our bodies. So you don't want to get to a place of such disconnect with yourself that you forget that your body is you, and you're like living completely from your head, because then you kind of like feel contempt for your body. And you treat it as if, it's not up to your standards, and you punish it, and that's self-hate.
Yeah.
So, if you overdo any of these things, because in your mind you have a standard of, physical functionality that your body is not up to, And, instead of kind of like loving your body the way it is and working with it, you kind of like attack it and hurt it, it's going to backfire no matter what you do. So it's good to kind of like, do it all from a place of like improving your happiness instead of like, mania. You don't want to be manic about it.
Right. And unfortunately, it's usually the people that are the least healthy that do that stuff. If you take care of your body and eat right and exercise, you don't have to be crazy, but the healthier you are, the better chance you are of not getting erectile dysfunction. You won't get it because you get older. If you could be a vegan 70-year-old that runs 10 miles a day and lifts weights, your erections are not going to be the same as they were when you were 20, but you will still get erections. As opposed to, drinking too much and partying too much and eating too much red meat, etc. It's going to come earlier in life than later. Yeah. But we'll all get it. All men will get erectile dysfunction just with age.
Yeah, or no, if not with age, at different periods. I've definitely known, I've heard, I have friends who, went through a painful, really difficult, unexpected or acrimonious divorce, and right after had either the dysfunction, during which like they just it all stopped because there was such a loss. They thought they had a life and a situation, and it was all,
they were sad and depressed.
Right, it all was gone from under them, and their life totally was changed. And they really wanted to be just the same they were before, and they weren't ready. Ready. It's a process, and sometimes it takes a year or two, and you gotta find who you are now, next time, in your next step. And I've also known of guys in the same thing, shocked by an unexpected betrayal. Usually like the wife has an affair and leaves them when they had no idea this was going to happen. And then they went the other direction, and they had the preapic, symptomology. So like they would get hard and nothing would happen. They could not get down. And and yes, it was painful. They would like try to stand on their heads, anything to get the blood down. But in the end, needed to go to the doctor. So it's like the body does stuff that's not permanent by any means. It's just kind of like reactions to trauma or, how we process change. So, we gotta be more accepting of that. Okay, so that's the shots. Let's talk a little bit about the sleeves and how they work, which I think they are, are they covered by insurance too, or do you have to?
Yes. Some insurance cover them. And there's actually the machine, it's called a VED, vacuum erection device. So in the urology world and medical world, they're called VEDs. What they are, if you can imagine maybe like a liter sleeve, a cylinder, like a water, that has the bottom cut out, and on top there's either a hand pump or a little electric pump where you put it over your penis. Now you have to put a bit of lube there to keep it airtight, and when you put it over your penis, it starts to suck like a vacuum. It starts to suck in, and as it sucks in, what it's doing is it's stretching out your penis, and while it's stretching out your penis, it's also sucking blood into the penis. So when your penis gets erect enough, at the bottom of the cylinder there's a little rubber ring that as you pull off the cylinder from your penis when it's erect enough, that rubber ring clamps around it to keep the blood in the penis without it draining out. Now, this always works because it's mechanical. Some men complain of painful erection because you have this ring around your base of your penis that, when you ejaculate, it's also not only going around your penis, it's also crushing your urethra. So it hurts a little painful painful ejaculation or discomforting ejaculation. Women like it because it's erect a lot, but the complaint from the women's side sometimes is that the penis, since it's got no circulation, it's not the same temperature as the man's body after a little bit, like a degree or two cooler.
Cools a little, and you're used
it cools
to
a little
being
bit.
Warmer. And
so warm and hot.
Less warm than average than the rest.
Yeah. And also it's a little mood breaking, some gentlemen say, because you're like, hey, darling, wait, I got to go and do this real quick. And it's a little, you got to do your thing, and it kind of breaks the mood, and you got to get back into the mood. But they're very effective. And they're very effective, and they're cost effective.
Exactly, they're super affordable, and I don't think it makes any difference to the mood. Whatever.
If you're used to it, if you have a loving wife and you guys are the same, but if you're on a date with a girl, or just
if you're trying to impress someone whom you don't know, it's very different. But if you are in a relationship of any kind,
right.
Sounds
So
good.
yeah, and then
We're going to the penile implants. So that's a little more invasive, right?
So that's an outpatient procedure. It's like a 1-hour surgery that in America you will always have it done by a urologist, and of that, maybe like 10% of urologists do these procedures. So the implant, if you want to know how it works better, because when I explain it, even to my friends, when you show them the animation, they're like, "Oh, that's how it works." If you go to the Boston Scientific website, it's ebcure.org. And on the website, it says treatment options. And then when you get the treatment options, if you go to the penile implant, there it'll say AMS. And when you click on that, there'll be a little diagram and a little animation of how it works. And it'll also have a live person doing it. The good thing about this implant is, other than the surgery, is that it's inflatable. So it's all internal. So you have 2 cylinders in your penis. You have a little pump that goes into your scrotum, which is where your testicles are. And then there's a little reservoir of saline that gets put in by your bladder. So it's all internal. Nobody's seeing it. So when the guy wants to have an erection, he squeezes the pump, which would be, let's call it his third testicle. It's in there with his testicles. When he squeezes it, every time he squeezes it, more and more fluid goes into the implant, and the implant gets wider and longer. We have 2 implants, one that just gets only wider and one that gets wider and longer. So the guy pumps it up as much as he can, and it's going to get very, very erect every time he does it because it's mechanical. So he could be sleeping, tired, hungry, had a big meal. It will work. And it's very satisfactory because it stays erect until you want it to go down. On the pump itself, there's a little deflate button. So if you're with your partner and you get super excited and you have an orgasm within like a minute or two, it doesn't matter. It will stay erect until you or she or he wants it to go down.
Wow,
so you can have sex as long as you want. So, obviously most guys are in their 60s and 50s, even 40s. But hey, you want to have sex after you want to make your woman have an orgasm, like you mentioned, it'll happen because you can be asleep and she can be there all day if you want to. It's very good in that issue where you don't have to worry about lasting longer. And when you're done, you push the button, and then the pressure that's in the penis deflates and pushes the fluid back into the reservoir of saline. Now these, although it might be the more invasive, the satisfaction rates are in like 95 and 96% from the studies that our company have done for the men and the women. Now, it's a mechanical device.
What's the
exactly? I was going to get to that. 75 to 80% of the implants are working up to 10 years. Now, most guys that get these, and when they stop working, it's mechanical. Sometimes, mainly the cylinders will rupture from use. So I've changed them, but I've been in surgeries where we've changed them out for people that have had them for like 22 years and sometimes only 2 years. It depends on either how rough your sex is, how frequent your sex is, or maybe, it just, it didn't work that well as far as working 10, 15 years.
Sometimes
but every guy that has it is so happy with its results and how good sex they were having and how they were pleasing their partner. They go right back and get another one because, it's an outpatient procedure. Yes, you will be sore for 2 or 3 days in your genital area and you'll have to put ice. But just like any surgery, that's outpatient, if you got a, boob job, nose job, penis job, you will be able to be functioning and be back to work within 3 to 4 days and wobbling around a little bit, maybe. But the implant you won't use after surgery for like 4 weeks because you have to let everything heal. But most of these guys have not had an erection for like 3, 4, 5 years. They don't mind waiting the 1 month or so to activate their implant.
Yeah. Yeah. Oh, that sounds great. I think that, it's much more functional. I mean, in my opinion, there is so much cosmetic surgery out there that I personally like for moral or political reasons disagree because we do it exclusively for like the other. So like we objectify ourselves, like you mentioned, like whatever, the boob surgery or, the nose surgery. Well, I mean, really, that doesn't serve much in real life. You take a break from life, you spend the money, you hurt yourself, you get a scar, and then whatever, you think that you're more attractive, but it's not such a, but this is something that actually changes the quality of your life, like the functionality, you know, how you live your life. It's like having knee surgery where before you you couldn't hike and now you can. It's like
everything,
something,
yeah.
right? It's something that is a real, active improvement.
Right. And for interpersonal relationships, as a man, when I got into this business, I'm like, oh, can't get it up, can't get it down, no big deal. But if I'm married to somebody or I have a lifelong partner, after 30 years, I start getting ED. I take Viagra, it works. No, it doesn't. It's not working so well. So now when we go to have intercourse, we get embarrassed. I get embarrassed because I can't get an erection. My partner, she doesn't think I love her anymore. She doesn't think I think she's beautiful. Now, if we're out walking around the streets and she wants to hold my hand, maybe I pull back because what if she holds my hands and we end up somehow having sex? I don't want to be in that uncomfortable situation. So I've talked to a lot of couples that get these implants and they're super happy with it because they can have sex when they want. Now, some of these couples, if not most of these people in their 60s and 70s, are having sex 5 times a year. But the fact that they know they can have sex, if she wakes up in the morning and kisses him and says it's a beautiful day, he'll kiss her back and say, yes, it is a beautiful day, darling, instead of pulling back because what if they end up having sex?
Exactly.
They'll be okay.
Exactly.
If they're at the movie, she wants to lean on his shoulder. If they want to hold hands in the park
That's very
or dance
important.
together.
Yes.
It definitely saves a lot of relationships when there's erectile dysfunction in the relationship.
Yes, I agree. Yeah, that's very true. That it kind of like, enhances the intimacy all day long.
Right.
Because
the friendliness, he's more friendly. He's not grumpy like, oh my God, and that can cause all kinds of problems.
Exactly, it can, like insecurity. He doesn't have the kind of like deep-seated insecurity where he feels like actually, she doesn't. I don't want to be that intimate. I don't want to be that close. I don't want to be put on the spot. Whatever. Yeah. So in I think countless ways, it's super useful.
Right. And it takes people like 15 seconds.
Wow.
I'm sorry, go ahead.
Yeah. No, people should not, give up on something that's so fundamental and common, to me, when I say speak sex, it's not about, sex per se. It's about life. It's like speak the truth. Like the few things we all do in common are really the things that have to do with the body, right? So, having sex and having that connection is so fundamental to a happy life. Yeah. And
like I was saying, one of the highlights of the implant is it takes like 15 seconds to go from empty to erect. So you don't break the mood. You can have sex when you want it. It's spontaneous. And
that saline like doesn't need to be replenished.
Yeah, no, it's saline. Usually if the implant damages, the saline leaks out. And, it's saline. Your body, it has saline in it. So it's not toxic. It's absorbed by the body. It's not toxic. It's just ruptures. And all of a sudden, the guy will pump it up and be like, hey, it's not so hard. And usually a couple of weeks, he's like, oh, my God, it won't go up anymore. So they go see their doctor, their urologist, and they can go and, schedule a procedure.
Right.
Now, if somebody was interested in any of these implants or injection or anything, they should definitely see a urologist.
Yes.
If they're interested in the implant, if a doctor does these implants, he also does the injections and everything. But on that website that I gave, there is a zip
doctors,
code. Yeah, find a specialist.
You can
put in
find
your zip
someone
code
in your area. Yeah.
Right, you can find somebody in your area. And that once again is edcure.org.
Yeah. Part of this is also about the woman kind of being accepting and being turned on by it and showing desire for it, and not seeing it as anything other than natural. So it's like it's part of the body, and not not feeling that wait, that's not what it should be. It's not normal. It's not real. All that bullshit that's in our head that doesn't serve us, we should like completely get rid of. And because I feel that a lot of it is how we see it, how the partner, how the woman, sees it. So if the woman encourages it, if the woman says, honey, I just heard this, like I want you to look into it, that makes the world of difference. And
no, for sure. And also
like if you find yourself with a guy who has this or is thinking of using it, just like push him, make it feel totally normal,
Right.
I feel
a lot of couples come together.
Yeah.
to the doctors, they come in with their boyfriend or their wife or their girlfriend. Yeah, and it's a team thing. They're both very interested to it.
So many men kind of like get, out of use, they get out of habit. They kind of like, give up or, it's like the proverbial like 40-year-old virgin. How did you get to be that? Well, because you kind of like start thinking of yourself that way.
Right.
So something could begin as a very temporary, psychosomatic experience caused by all kinds of stuff, and everybody's psychosomatic expression differs. It's like you could get overwhelmed by change in your life and break out in hives. And that's something visible. You see it, and it has nothing to do with anything. It's just you're under stress. The same thing can happen with your like sex life. You could just like stop being functional the way you thought you were functional. It can happen to women, where they clamp.
You miss out on a big part of life.
They can't, the vagina like will not, they contract, and they cannot relax those muscles, and it's just a psychosomatic stress response. So yes, there is of course the option of like talking to people, which takes a lot of time, the talk therapy and all that. There's also the option of like doing tantra and breathing and, incorporating all of that. But I feel that the most important thing is to just like be done with the stigma. Okay, wonderful. So I think that we covered, all of my questions have been answered, and I had a lot, like I knew very little, and now I feel fully versed. So thank you so much. Yeah. Thank you, Victor, and
no problem.
Thank you to everyone out there who is listening. We will be back next week. And
perfect.
Until then, speak sex. If I could make love incessantly, I would be God.